Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear an interview with Nurse Maria, a postnatal care nurse, discussing her role in caring for women after childbirth. You now have 90 seconds to read questions 31 to 36.
Good afternoon, Nurse Maria. Thank you for joining us today. Could you tell us about your role in caring for women after they have given birth?
Good afternoon. My main role is to support new mothers in their recovery after childbirth. This includes helping them with breastfeeding, monitoring their physical health, and providing emotional support.
That sounds like a very important job. What do you find most challenging in this role?
One of the biggest challenges is helping mothers who are struggling with breastfeeding. It can be very stressful for them, and I have to ensure they feel supported and not discouraged.
What are some common issues new mothers face during this time?
Common issues include pain from childbirth, fatigue, and sometimes postpartum depression. It's important to address these issues early to help the mother recover both physically and mentally.
How do you help mothers who are experiencing postpartum depression?
We provide a lot of emotional support and encourage them to talk about their feelings. Sometimes, we refer them to a specialist if they need more help.
Lastly, what advice do you give to new mothers to aid in their recovery?
I advise them to rest as much as possible, eat a balanced diet, and not hesitate to ask for help from family or healthcare professionals.
Now look at Extract 2. Extract 2. Questions 37 to 42. You hear a presentation by Dr. Emily, a nutritionist, discussing the diet of breastfeeding mothers. You now have 90 seconds to read questions 37 to 42.
Good morning, everyone. Today, I'll be discussing the importance of a balanced diet for women who are breastfeeding. Proper nutrition is crucial during this time, both for the mother and the baby.
What are the key components of a good diet for breastfeeding mothers?
A good diet should include plenty of fruits, vegetables, whole grains, and proteins. It's also important for mothers to stay hydrated by drinking plenty of water.
Are there any specific foods that mothers should avoid while breastfeeding?
Yes, mothers should avoid excessive caffeine, alcohol, and foods that may cause allergies, such as nuts, if there is a family history of allergies.
How does a mother's diet affect her breast milk?
The quality of breast milk is directly influenced by what the mother eats. A balanced diet ensures that the baby gets all the necessary nutrients for healthy growth.
What about supplements? Should breastfeeding mothers take any?
Yes, in some cases, supplements like vitamin D and omega-3 fatty acids are recommended, especially if the mother's diet lacks these nutrients.
What is the most important piece of advice you would give to breastfeeding mothers regarding their diet?
The most important advice is to maintain a varied and balanced diet and to listen to their body's hunger and thirst signals. Eating a healthy diet is essential for both the mother's recovery and the baby's health.
That is the end of Part C.
AVN Pharma Education.